Hope your week is off to a good start. You're watching Arirang TV's continuing coverage of COVID-19. More than 1 million people worldwide have lost their lives to the virus since it was first reported outside of China early this year. Here in Korea, meanwhile, 80 people passed away this month alone following a jump in cases starting mid-August. We start the program now with the latest numbers on the pandemic here in Korea and elsewhere around the world with our Kwon So-ah. Now, So-ah, we are starting the new work week with a drop in the number of daily infections, but authorities are calling for continued caution, I hear. Please tell us more.
Right, Sunny. Just a few days ahead of the 5-day Chuseok holiday, we are close to what health authorities have been hoping for, a number below 50. In fact, we're at exactly 50 this Monday. That is the lowest figure since August 11th, meaning the lowest in 48 days. And with 10 imported cases, that means domestic cases were at 40 this Monday. So we are seeing quite a drop.
Right, but like you keep emphasizing, we need to keep in mind that the number of tests conducted over the weekend is fewer when compared to those conducted over the weekdays, and authorities are worried about a potential drop in public caution ahead of the Chuseok holiday, right?
Exactly, Sunny. So despite the current decline we are seeing right now, the Chuseok holiday remains a huge hurdle, and that is why we are currently having the special prevention period from September 28th to October 11th. And on Sunday, Prime Minister Jung Se-kyun reminded citizens of the government's advice this Chuseok.
I sincerely urge you to refrain from visiting your hometowns over this year's Chuseok holiday to ensure the safety of your parents and the elderly. Try to think that the best way to show your love and respect for your parents is by not visiting them this year.
Authorities, just like Jung, are advising that abiding by such recommendations and basic social distancing measures will help in how the numbers will develop. We are seeing 50 cases here, as I said before, raising the total to 23,661. The death toll has surpassed 400 over the weekend, with 5 additional reported this Monday. So 406 is the number we're seeing, and what's a concern is the number of people that are in the elderly group. In fact, this September alone, we had 80 cases of fatalities. And in the meantime, a little less than 1,200 people remain in quarantine, and we have almost 21,300 cases of people who made a full recovery of COVID-19 here in the country. Now, let's take a look at our graph now. For 3 consecutive days, the numbers have been in the double digits, but we see that the 3 days before they were in the triple digits, and again the days before that we were in the double digits. So we can see this trend of fluctuations. So we will still have to see how the week progresses. And if we go over to our map, we have double digits in the capital Seoul and Gyeonggi-do province, and also sporadic infections still in many other parts of the country, although only 1 case has been reported in many parts of these provinces or cities. We know that this single figure can turn into double digits if we lose our vigilance.
Meanwhile, so on the international front, as I mentioned at the start of the program, we are noting yet another alarming figure.
Yes, Sunny. As of Monday or Sunday, depending on where you are, the novel coronavirus has killed 1 million people around the world. And that figure, many saying not even close to being accurate. But if you do take a look at the official figures, 1 million and almost 2,400 cases have been reported as of noon Korea time. And the total number of infections stands at over 33.3 million, with almost 250,000 cases reported in just 24 hours, and around 24.6 million people have made a recovery. Now let's move over to the major outbreaks around the world. Still the US here on top with 7.3 million cases, but the gap between India and the US is narrowing because India again has seen some 80,000 new cases, and followed by Brazil at 4.7 million. Over the weekend, Peru has surpassed 800,000 and Argentina has surpassed 700,000. 1,000 total infections. Meanwhile, France has seen another 11,000 new daily cases. If we take a look here, now at almost 540,000. And the UK also had some 6,000 new daily cases. So we are seeing still many places, including wealthy nations, that are dealing with these resurgences, struggling with containing the virus. But the Wall Street Journal wrote a piece on how Korea successfully managed the pandemic, saying it has cracked the code with a straightforward, flexible, and relatively easy to imitate solution. And blending technology and testing has been highlighted, as well as Korea's twice-a-day briefings on the coronavirus, where authorities are informing the nation's people and also warning of contingencies. And I will be back with one of those updates of that briefing later in just a bit. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. Right, on the local front, Chuseok has a long history and has traditionally been spent with family and friends to celebrate this year's harvest, to thank ancestors, and to pray for yet another bountiful year. But this year's Chuseok commemorations are poised to take on, that is, a new look, as the pandemic keeps festivities and practices in check. To take a look.
A mass movement of people usually takes place on an annual basis here in Korea during the Chuseok holiday period. However, this year, far fewer people are expected to travel due to the COVID-19 outbreak.
추석 연휴의 유행 관리가 무엇보다도 급선무입니다. 대규모 인구 이동은 분명히 전국 유행 확산의 원인이 될 것입니다.
The government has designated a 2-week span from September 28th to October 11th as a special disease containment period. This marks the first time in the country's history that the government has asked its citizens to refrain from traveling during the Chuseok holiday as part of efforts to contain the COVID-19 outbreak. Many citizens are aware of the severity of the situation and are looking to cooperate with the government in this regard.
이번에는 코로나 때문에 모이는 자체를 지금 취소를 하고 있는데.
A recent study has shown that 7 out of 10 Seoul residents had either canceled or did not have any plans for long-distance travel during this holiday. According to the Korea Transport Institute, the number of people returning to their hometowns for Chuseok this year is expected to drop nearly 30% compared to last year. The government has also temporarily eased an anti-graft law to encourage people to exchange more gifts during the holidays. The measures are aimed at revitalizing the local economy and helping farmers who have been struggling amid the string of recent floods and typhoons.
우선 청탕급지법 시행령을 개정하여 추석 전후에 한시적으로 농수산물 및 농수산 가공품 선물가액 상한을 현재 10만 원에서 20만 원으로 상향 조정하고자 합니다.
COVID-19 has also brought changes to gift-giving trends for Chuseok, with health foods and supplements becoming the most popular gift ideas for this year's holiday. Also, Chuseok gift sets that include sanitary products such as face masks and hand sanitizers are also being sold on the market. With more people sending gifts instead of holding family gatherings, the volume of parcels is expected to rise more than 15% this Chuseok compared to the same period last year. Despite being unable to travel due to social distancing measures, people across the country are still finding ways to stay emotionally connected to their extended family while ensuring a safe COVID-19-free holidays.
It's time now for the regular afternoon briefing on COVID-19 here in Korea. The daily caseload today stands at 50, following 95 cases this past Sunday and 61 this past Saturday. Now, despite the drop to double digits, authorities are urging for public vigilance ahead of this week's extended Chuseok celebrations. Here now is a reminder of some of these special safety measures in place amid the Lunar Harvest Festival. To discourage travel, dining and drinking at highway rest stops have been banned starting from tomorrow until the end of the Chuseok holiday. These establishments will offer takeout services this year only. Also, officials have decided to charge toll fees at highways this year with the aim of again discouraging travel. National cemeteries will also be closed during this year's Chuseok holiday, and family members are being urged to pay their respects to their ancestors at homes instead. Likewise, for those who have elderly parents living in different parts of the country, they are being advised to send presents instead of traveling across regional boundaries. Public rallies are also being discouraged to prevent large-scale cluster infections. Now, the measure comes amid expectations for such public gatherings on the 3rd of October, that is this Saturday, to mark National Foundation Day. Now, a large part of the special measures during the Chuseok holiday correspond to those under Level 2 social distancing. Gatherings of more than 50 indoors and 100 outdoors remain banned. Operations at high-risk facilities, including buffet restaurants, clubs, cram schools of more than 300 students also remain banned. Now, in-crate cafes, however, are being allowed to operate but cannot accommodate minors, and they can serve light meals, however. The briefing has yet to start. We're still waiting for it, and perhaps while we do, we can take a look at today's figures as announced by our consul. We have 50 cases, as I mentioned at the start, 50 cases raising our total number in Korea to 23,661 cases. 5 people lost their lives today, raising our death toll to 406. Health officials expect this figure to further rise as we have 120 people in serious and critical condition as of today. Now, please remember that that figure of serious to critical condition stood in the single digits in mid-August. We have 1 person in quarantine, raising our number to 1,963, and those who've recovered stands at 21,292. We are still waiting for that briefing to commence, so perhaps now we can take a look at the Level 2 social distancing here in the country. Like I said earlier, these guidelines correspond to the special guidelines that we have in place for the Chuseok holiday. I think the briefing is about to start, but while we do wait, please do take a look at the guidelines we have. There, I hear the briefing has started. We'll come back to you with a summary of it afterwards.
Let us now begin our regular briefing, and here's Commissioner Jung Eun-kyung. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of September 28th, Monday, we have a total of 40 new local infections and 10 new imported cases. The total caseload now stands at 23,661. Currently, we have 1,963 people in quarantine undergoing treatment, and we have 120 patients in severe or critical conditions, and we had 5 additional fatalities. The accumulated death toll now stands at 406. The fatality rate stands at 1.72%. I extend my deepest condolences to the deceased and the members of the bereaved families. Let us now look at the major updates on our domestic infections, starting from the Gangnam-gu district in Seoul City in Daewoo Plus. We have 4 additional cases. A total of 52 cases have been confirmed to date. And in Dobong-gu district, in relation to the Yemaru Daycare Center, we have confirmed that 3 more people have been infected, and a total of 27 have been infected so far. And in relation to the Sammo Sporex sauna in Gwanak-gu district, we also have additional cases. A total of 29 cases have been confirmed to date. And in Bagewon in Goyang City of Gyeonggi-do Province, which is a mental care healthcare center, we are also carrying out investigations currently, and we have 2 additional cases being confirmed, and a total of 41 cases have been confirmed to date. And in Gunpo Anyang City, in relation to a family gathering, we have 5 additional cases being confirmed, and 7 people have been confirmed to date. As the risk factor, we have identified that they shared meals together and also engaged in close dialogue. And in relation to a senior gathering in Pohang City, we have 3 more cases being confirmed, and a total of 11 people have been confirmed. 8 of them were participants, and 3 of them were the acquaintances. And next, moving to the imported cases, we had a total of 10 new imported cases. 7 of them have been reported through points of entry, while the rest of 3 have been reported while on self-quarantine. As for the countries of origin, we have 2 from Uzbekistan and 1 from India, Indonesia, and Nepal, respectively. And looking at the quarantine analysis for the past week so far, we have some analysis and outcomes, and we have seen on an average domestic infections, we have about 76 cases, which is a decrease by some 31 cases compared to the previous week. And we also have 8 cluster infections, which is down by 12 from the earlier week. And we also have about 20% of the cases which are untraceable. And as for the imported cases, we have seen on a daily basis of 14.3, which is quite similar from the previous week. This is between the numbers of 10 and 15. So during the past week, we have lost 18 lives. And as for the age group, we have 5 in the age group of over 80 and 2 in the age group of 60s. And also we have identified 17 had underlying illnesses and 1 case we are under investigation. And looking at the past week, as for the sources of infection, we have seen that 184 cases, or about 29% of the total cases, were related to domestic clusters, and about 154 cases were contacts with previously confirmed cases as well. And we also have numerous cases which are under investigation. And as for the trends of outbreak, we have seen that we have clear cluster infections through nursing hospitals and clinics, as well as multi-use facilities, including the restaurant and sauna, as well as religious centers and door-to-door sales facilities. So we are witnessing continued cluster infections. And as for these cluster infections, we have identified the risk factors were very similar, and these are being repeated. And starting from this week, we will go into our Chuseok holidays. And starting from this week, we believe that many people will be enjoying an extended week of holidays. However, we ask you to refrain from going outdoors and also stay home safe and sound. And as we have experienced in the months of May and August, where we had a mass movement of people, we saw a rebound in the number of cases. And we believe that we should encourage the public to refrain from going outdoors and going on non-essential travels. And especially for the senior citizens, as they are exposed to higher risks of infection, we ask you to refrain from visiting them and rather talk to them via video chats. And when you have to visit your hometowns, please abide by quarantine measures at all times, and please use private automobiles as well. And please also use these automobiles only in family units. And as for the public transportation, please reserve your tickets in advance, and also pack your snack and water in advance so that you can minimize the time of stay at rest stops. And when you are visiting your relatives at hometowns, please wear your face mask and also wash your hands on a regular basis. And when you are eating together, please refrain from engaging in dialogue, and please wear your face masks as well when you are not consuming food. And also please minimize the number of attendees at the ancestral rituals, and also minimize the physical contact with others. And during the Chuseok holiday, we are operating the screening clinic as usual. So if you have symptoms, please go to these clinics and get tested. And we also have the welfare ministry homepage, and also we have our call centers, or you can call 119, or also we have the portal websites where we also have information on the emergency health clinics as well. And during the Chuseok holidays, today is the Monday of the beginning of this week, and we believe that we are going through an unprecedented period of time. However, we ask you to send warm words of greetings instead of visiting your loved ones, and we ask you to recharge during this week. Please note that when we have a minimize and reduction in the number of movement of people, we will have a reduction in the virus transmissions as well. And it is very important for us to go through a safe Chuseok so that we can return to our new daily routines during autumn and winter as well. And please stay vigilant going forward, and please abide by these special quarantine measures during this special week of antivirus prevention. And we have two major risk factors during the holiday. First is a family gathering, and also second is the transmissions through travel. And as we experienced in May when we had the Parents' Day, when we had also cases of family gatherings, when they also had large transmissions of the virus, and in earlier this month as well, we had also a case where a senior person lost his or her life after being contracting with the virus through one of their family members. So it is very important that you need to take particular precautions if you are living with these senior citizens. And please note that you need to take care of yourself if you have symptoms. And even if you do not have symptoms, please note that the virus can spread even without symptoms. And also refrain from gatherings of large groups of family gatherings to enjoy dining as well. And second risk factor is the travel. During the summer holidays, many people went to the camping sites. However, we also had many of the families visiting these camping sites where they had transmissions, even contracting the virus by the children. And there were also these group travels to diverse areas. And please note that these large groups of people, when they travel together, if there was a single person who has been infected, he or she can spread the virus to other participants, and thus spreading the virus to other cluster meetings as well. So even if you are going on travel, please refrain from the so-called 3C environment, which is crowded and confined and close contact environment, and please enjoy the nature outdoors. During the Chuseok holiday, if you have symptoms, please note that you need to visit the screening clinics, and please get informed through our applications or our homepage. And please note that there are many people who are exerting their full efforts, including the medical practitioners during the Chuseok holiday, and I extend my deepest appreciation once again. We will also exert our full efforts. Thank you very much.
사전 질문 또 현장 질문 먼저.
Right, that was Chung Young, Commissioner of the Korea Disease Control and Prevention Agency, with Monday's afternoon briefing. So, what was the gist of her address today?
Well, first off, she gave some numbers on the situation in the past weeks. She said the average number of daily infections in the past week stood at 75.6, which is down by almost 32 from the week before. And imported cases stood at 13.4 on a daily average. That's pretty much the same, similar to what we saw the week before. And almost 30% of infections were cluster infections. And we also had 18 people who lost their lives in the span of a week. And major spots of outbreaks were medical facilities, as well as multi-use facilities, religious gatherings, and door-to-door businesses, and many other small gatherings as well. So we still have to be careful, especially as the Chuseok holiday begins this week. And Chung said there are two big risk factors, which are family gatherings and transmissions that could occur through traveling. So that's why she also mentioned that to refrain from moving around, and especially be careful when you meet your elderly parents or other relatives.
All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Xenophobia, discrimination, and
prevent hatred and
unity among the people in fighting the outbreak.
비난과 혐오로는 코로나19와의 전쟁에서 결코 승리할 수 없으며 우리 공동체에 씻을 수 없는 상처만 남게 됩니다.
Fear of COVID-19 appears to have given birth to a senseless fear of things considered foreign. In fact, xenophobia and homophobia are further threatening the stability of society. To address this unfortunate matter, I have Professor John Park from Handong Global University. Welcome back, Professor Park.
Good to be here. Thank you.
And I also have Professor Kaz Porter from Korea University. Hello, Professor Porter.
Hello, thanks.
And from the US, I have Professor Russell Chung from San Francisco State University joining our session virtually. Pleasure to have you back, Professor Chung.
Thanks for having me.
Professor Porter, we'll start with you then. According to a study by the National Human Rights Commission of Korea, fear of contagion appears to be fueling widespread resentment towards certain groups of people. Please do start by explaining this phenomenon for us.
Well, I'm not sure I can explain it entirely, of course, but I think at the heart of the matter is a growing sense of insecurity. As we know, over the last few decades, economic insecurity has increased as costs have exceeded incomes, and coronavirus, I think, has served to amplify those feelings of insecurity directly on an economic level by threatening people's livelihoods over the next year or so, and also, of course, physically, because the virus itself is invisible, unpredictable, and difficult to control. And so I think this causes a degree of frustration and also a desire to increase the level of control in people's lives. And I think they have more or less two options. One is to direct control and try to regain control by focusing inward on controlling themselves and their own behavior or that of those around them, which I think would only serve to increase or only serves to increase frustration. Or the sadly more efficient solution perhaps is to direct that frustration outwards towards others, strangers outside of us, because that serves two purposes. One, it provides an outlet for one's frustrations, and two, it directs those frustrations away from the people who are close to one, thereby allowing sort of domestic peace to reign as it goes forward. So it's quite easy, or it's simpler for many people, sadly, to point the finger at some other strange group, different group.
And such frustrations, Professor Park, has led to, of course, hate speech and hate crimes. Before we delve any further, though, perhaps we could start off with the definition of the phrase hate speech. Is there a legal definition for this phrase here in Korea?
Yeah, I think there is a legal definition, depending on, I guess, which entity we're getting the definition from. I think the average person will understand hate speech to be something along the lines of some sort of statements, abusive or threatening statements that is directed at a particular group based on race, ethnicity, national origin, religion. So we understand that as a lay definition, but legally I think the National Human Rights Commission of Korea, as well as the United Nations, have given some more clear definition, and I can sort of read one definition from the UN committee, which is any kind of communication, writing or oral statements, or even behavior that attacks or uses pejorative or discriminatory language with reference to a person's group based on religion, ethnicity, nationality, race, color, descent, gender, or other identity factor. The National Human Rights Commission definition is similar, but it does add a couple other things like disability, age, and region or region of origin. So those are sort of working definitions. I think every country around the world has some varying degrees of that definition. modified to some extent. But I think there is another category issue that we have to work on, which is, does hate speech fall under hate crime? I think most people can agree that hate speech is a subset of hate crime, which requires something more of an overt act, an actual physical act of violence perpetrated in the context of a targeted group. Whereas hate speech is, we're criminalizing speech, so in some ways it is content-based. And that's when, hopefully later in the program, we'll get into a little bit about to what degree is even defining the definition important for legislative purposes.
Of course, of course. Professor Chung, back in March, we spoke about a website you helped to start to track racist attacks against Asian Americans amid the pandemic. Now, it's been about 6 months since we last spoke, Professor Chung. Please do update us on your findings so far.
Well, thank you. We've continued to get reports from across the nation in the United States. We have over 2,600 incidents now. 8% can be constituted as hate crimes where people are physically assaulted, including being spat and coughed upon, and that includes hate speech, so that hate shows the racial bias. 70 to 80% are actually incidents of harassment, verbal harassment, and shunning, so that when people are deliberately avoiding Asian Americans. And 8% constitute civil rights violations, where people are mistreated at the workplace or get barred from establishments. We found really clear trends. They're pretty consistent over the last 8 months, or 6 to 8 months, where women are targeted 2.4 times more than men, and people are bullying whom they think are vulnerable populations. The elderly are often harassed, and our youth are also being attacked.
I see. Professor Chung, I also understand the U.S. House of Representatives in response recently passed a resolution, I believe it was on the 17th of September, a resolution denouncing acts of racism against Asian Americans in light of the pandemic. Tell us more about this, please.
Yes, this resolution, there's also a Senate resolution, denounces the spate of anti-Asian speech, including use of stigmatizing terms like Chinese virus or the plague from China. Asian American congressional members introduced a resolution, and it overwhelmingly. The sad part for me is that 164 people didn't support this resolution, meaning that they didn't want to condemn anti-Asian sentiment, that they think it's actually possibly valid. It was a real partisan vote in that in the United States, the Republican Party voted against the resolution, whereas the Democratic Party supported it.
I see. Professor Porter, would it be reasonable to assume that COVID-19 has simply aggravated existing feelings of hate towards social minorities, and that perhaps the pandemic has provided these aliens or perpetrators perhaps with reason to act out their feelings of resentment?
I don't see that it's the disease itself that gives them opportunities or reason to exert their frustrations on others. I think perhaps, as Dr. Jung was just suggesting, that it has something to do with the politicians involved in this process. And particularly, I'm thinking of the case of the U.S. here, in that some of our politicians are actively harnessing this frustration and aggression for their own political ends. In order to build their own power block, they can unite their followers or their members of their party by pointing the finger outward, rather than trying to find opportunities or ways of working within to improve their own response to the virus, I think.
I see. Professor Park, what legal efforts then are there to to protect minorities from this situation? And we can start with Korea perhaps, and then move on to elsewhere around the world.
Sure. I think an average person might say, hey, hate speech is bad. Let's just get some wording on the statute and get it in the books and just regulate it. But it's quite difficult because there's multiple factors in legislative entities trying to craft a sensible legislation first, and several factors go into this, of course. But first and foremost, is the right for public citizens in a free, robust, democratic society to express opinion that may not be preferred or even enjoyed by others. And so balancing free speech consideration along with unlawful speech is something that the legislative bodies have to wrestle with. Of course, as I mentioned earlier, the concept defining what is free speech, I think definitionally is another challenge for legislative bodies, because some of that deals with sort of the societal and the historical feelings about certain statements or certain words, certain buzzwords that trigger maybe animosity or hatred or maybe even incite some form of violence. Of course, as Professor mentioned, even sort of the politics of it makes this a more difficult thing to establish. In Korean context, of course, Korea also has faced this difficulty, and National Assembly has been unable so far to craft a language sufficient to pass a hate speech regulation. Some of the other countries, of course, have dealt with this problem differently as well. Places like France, UK, and Canada have been trying to regulate this in broadcast, maybe. In the US, there is no free hate speech per se regulation that is allowed or disallowed because the federal sentencing guidelines, for example, enhances penalties for certain crimes that evoke racial things, but there is no law in the books about hate speech per se. So different countries are tackling the issue differently. I think Korea needs to think long and hard about sort of what's involved here, and of course learn from other countries, but craft something that makes sense for Korea by itself.
Right. Professor Porter, have we witnessed such cases of frustration being taken out in the forms of racism, etc., during previous outbreaks, for example, the one including SARS and so forth?
Yeah, I think we have seen some of those. I wasn't in Korea during SARS, but I was here during MERS, and there certainly was an increase in tension related to Middle Easterners or darker-skinned foreigners at that time. But I would suggest that perhaps a better comparison might be thinking about HIV/AIDS in Korea, right? Also a virus that is more enduring, right? Both MERS and SARS were very brief epidemics that came and went before long-term prejudice, I think, could sediment and express itself. But if we think about something like HIV/AIDS, this virus has been, at least in my understanding in Korea, has been blamed on foreigners, on sexual minorities, and this has resulted in a sort of repression of information and strategies for handling it that has actually increased the prevalence of HIV in Korea. So,
unfortunately.
Yes, so this kind of prejudice can actually lead to a worsening of the spread of these epidemics.
And staying with the idea of prejudice, Professor Park, do you see such targeted acts of hostility or resentment as affecting decisions to get tested for COVID-19? Because during the outbreak that we had in Itaewon earlier this year, there were cases where certain bars were hosting certain sexual minorities, and there was fear that once you get tested, people might think you were part of that group and so forth. What are your thoughts on such cases affecting decisions to get tested and to contain the virus?
Yes, I think common sense would say that anyone who's maybe been to a certain region or a certain location of a cluster infection, if someone is known to have been there or sort of been in that vicinity, I think the common sense is that, sort of to stay away, of course, and to try to determine what exactly happened. And so I think some of when you have mix that kind of sensibilities into the equation with maybe minority groups or maybe disenfranchised people or disadvantaged people, then I think there's a sort of added layer of hostilities that can be had. But we all know that the virus infection or the virus is random. It's not doesn't target a particular someone with particular religious sensibilities or race or ethnicity or gender, and so. I think we understand that this could potentially happen. So now then what do we do about it? I think the government has, as Korean government has been lauded so far, even from the top down, I think has been very good about public broadcasts, and even the media, I think, has a certain good role to play in public service announcements about what's happening, as well as even educational endeavor from Ministry of Education, really trying to encourage the sort of high sophistication in Korean sensibilities to where even we're looking at this hate speech regulation, not to have a sort of a knee-jerk reaction to put something on the book just for the sake of putting something on there, but to really deliberate even within the context of the COVID-19 crisis.
Right. Professor Chung, authorities here, as Professor Park just mentioned, have been garnering much global recognition for their response to COVID-19. Professor Chung, how would you then assess Korea's response perhaps to hate speech or crime?
I think Korea's approach is actually probably wise because, like Professor Park said, it's really hard to legislate and enforce hate crimes. Especially the way it's written in the United States, you have to prove malicious intent. You need to have witnesses where the perpetrator needs to use racist language and hate speech. And again, as our data shows, 80% of the cases are actually hate incidents that don't rise to the level of being a crime that could be arrestable. So rather than making the issue hate speech or hate enforcement, in the United States, our approach is to just address racism at its root causes, to promote more public education, like Professor Park said, public service announcements, encouraging civility and respect. In the United States, we're pursuing a civil rights mediation approach. Again, rather than criminalizing the conduct, we suggest people's rights are being violated. In the US, we have the right to safe access to goods and services. So if Asians are being harassed, they don't have that safe access. And so we're encouraging people to pursue that code. It's a civil code. And rather than punishing the perpetrator, we seek remediation.
I see, and raising awareness, of course. Professor Park, staying with the situation here in Korea, can we expect any relevant laws with regard to this situation in the near future?
Yeah, I think, as I mentioned earlier, the National Assembly has been making some efforts in several go-arounds, and fortunately or unfortunately, right now there's no conclusive legislation on this issue. Just recently, though, I think the recent 20th National Assembly body, I think, we're trying to maybe modify or enhance an existing law, such as what's called the Information and Communications Network Act. Of course, cyberbullying and cyber crime is a serious issue everywhere, also in Korea. And so sort of working with the existing laws to add this layer of discrimination or prejudice or some sort of hate speech in the digital crimes arena, I think is some step. There's already actually other laws in Korea that exist that have already punished people for certain statements, whether it's through defamation laws or some other insult laws in Korea. And I think there's some room to work with in the context of those things. As I mentioned earlier, in the US, you have the sentencing guidelines that enhance the penalty with the existing laws that has a racial component or these other sort of hate speech component. Because we do need to be cautious about knee-jerk legislation that is such a strong grip on constitutional freedom of speech, and that we need to be always aware that, yes, we want to regulate to some extent certain words that incite violence. You can't yell bomb in an airport or yell fire in a crowded theater. These things are already, you can't do. You can't incite violence. You can't, of course, have obscenity speech. And so we need to be able to beef up some of these things already and perhaps add this, even if we're not able to come up with this a free speech legislation.
Right. Professor Porter, what measures can be taken on an international level, perhaps I understand it's an idealistic question, but internationally to address the issue of hate speech, hate crimes and so forth?
Well, I think actually when we think about the international level, we tend to think about those large organizations and what have you. But I think that in thinking about this, it's more useful, again, for us to think about the sort of grassroots organizations, perhaps like Dr. Jung's organization, that are working to identify these crimes or these incidents and to expose and oppose them. And so I think if we're going to overcome prejudice and deal with this sort of, overcome this frustration, then we need to, these organizations can network internationally is what I think would be the best, right? Because there's a long history of collaboration in the 1960s and 70s, global collaboration between Asian groups, African American groups, Latino, Latinx groups, Native American groups. So a lot of international work to fight these kind of prejudices. Then I think we need to rediscover that.
Right. Professor Chung, would you care to add to Professor Porter's words very briefly?
Yeah, briefly, it's an international pandemic and we need global cooperation. And I think if the world sees nations cooperating, sharing resources, sharing expertise, then that would actually reduce a lot of the xenophobia. And if politicians weren't using as much nationalist rhetoric, it would help a lot.
Right. All right, Professor Chung, thank you very much for your insight today. Professor Park, as always, thank you for being with us. And Professor Porter, thank you.
Thanks for having me.
Right, well, that ends our coverage of COVID-19 for this Monday. Now, do join us again tomorrow for a reminder about the measures necessary to enhance a safe Chuseok holiday amid the pandemic. In the meantime, do take care and thank you for being with us today.